Hi, it's Christina with the Sisyphean Journal. Today is March 7th, and we are looking at a very tragic case from Florida in 1978. Now, Dr. Ronald Tauber considered himself to be a maverick. He was a risk taker. Now, he'd lost his medical privileges over an abortion he performed at a Florida hospital. The administration wasn't too upset that the baby in question had been between 23 and 24 weeks. It's kind of teetering on the cusp of a constitutionally protected second trimester abortion and an illegal third trimester abortion. But actually, he had kind of ticked off the hospital administrators because he was performing them instead of on the medical ward, he was doing them on the obstetric ward, which was very upsetting to the obstetric nurses who were there because they wanted to deliver live babies, not pick up dead ones and send them to the incinerator. So, long story short, the problem wasn't the age of the fetuses, it's just that he was making the nurses extremely unhappy. And shortly after that, he lost his privileges at another hospital, which he said that it was a conspiracy to punish him for doing these second trimester abortions in Florida hospitals. However, Orlando General Hospital's president said that Tauber was suspended from the staff because he didn't meet the standards of practice. That assertion will certainly play out when we look at what happened to Gloria. Now, Tauber responded to losing his privileges by opening the Orlando Birthing Center. Tauber said he wanted to provide a more family-centered and lower-cost birthing experiences. Now, he lacked privileges to admit any of his patients to a fully equipped hospital, but said he did have arrangements with other local physicians who had privileges and would admit his patients if they needed care. Now, everything might have gone well if he had stuck to delivering live babies, but he decided he was just as interested in making sure fetuses came out dead as he was in making sure they came out alive. And as a space to do the abortions as well as tubal ligations and C-sections, he converted a concrete building adjacent to his gracious birthing center, picture in the thumbnail, and converted into a surgical ward. Now, the birthing center was kind of in a gray zone of legality. He intended to keep fewer than 3 patients overnight at a time, so it didn't qualify as a hospital, and he didn't exactly fall under the category for ambulatory surgical centers, so it was actually a doctor's office. Not just a fake clinic, but a fake hospital. But remember, places that do abortions don't have to be clinics. They just have to pretend to be clinics, and they're good. It's only bad if you hand out diapers. Now, into this comes the unfortunate Gloria Jean Small. Now, Gloria was a 34-year-old mother of 6 children, ages 3 to 19. Now, she'd done her best to supplement welfare with work at a fern farm and occasional cleaning jobs at the nearby Brass Rail Bar. And neighbors described the family as being very close-knit. Now, in January of 1977, Gloria had a positive pap smear and was diagnosed with, let me try to pronounce this correctly, sarcoidosis. That is a problem where you're getting lungs cluttered up with gunk. Her doctor, Stephen Spohr, described her as a pulmonary cripple and noted that just trying to converse left her gasping for breath. And as her health deteriorated, she could no longer work. And as if the breathing problems weren't enough to deal with, poor Gloria suffered from arthritis and ulcers. She spent a year in and out of the hospital for bone and liver scans, barium tests, and x-rays. Then, in February of 1978, Gloria discovered that she was pregnant. She scheduled an abortion at Women's Health Center in Orlando, but before the appointment, she developed double pneumonia and ended up hospitalized again. Now, she discussed her abortion plan with Dr. Spohr. Now, he believed that Gloria's health would be at risk whether she decided to give birth or undergo an abortion. Funny how at no point did they decide they were going to pursue a tubal ligation while they had her in the hospital for all these other things. Now, none of the doctors affiliated with the hospital that Dr. Spohr was affiliated with wanted to do the abortion. They did not want to kill Gloria's baby. So Spohr told Gloria to just go ahead and have the abortion at Women's Health Center. But by then, Gloria was 14 weeks into her pregnancy. Now, abortions past 13 weeks were legal, but there just weren't any clinics in the area willing to perform them that late. And I've talked about that before. A lot of clinics, they make various decisions about how late they're willing to do it, but a lot of it depends on the doctor. They are much, much more willing to do an abortion when they can just slurp the baby out through a cannula than if they're having to pull arms and legs off. This is the primary reason doctors draw the line. It's like, no, I don't mind something that looks like glop landing in the stockinette, but I don't want to see this mangled little face staring up at me. So Women's Health Center discussed her options with her. One doctor in Miami would do the abortion, but he charged $600 and Gloria would have to cover travel expenses. And the out-of-state facilities that were willing to do these later abortions were even more expensive. So they referred her to Orlando Birthing Center and the care of Ronald Tauber. She was around 15 weeks pregnant when she made her first visit to Orlando Birthing Center on March 2nd of 1978. She had a consultation with Tauber, who noted she discussed her need for sterilization and stated that she didn't want any further children. He noted that Gloria was struggling to support her 6 children, and she said she couldn't afford the full fee, and if Tauber didn't perform the abortion, she'd do it herself, and if she failed to dislodge the unwanted fetus, she'd just kill herself. So Tauber agreed to reduce the fee and schedule Gloria to return for her combination abortion and tubal ligation on March 6th. Now, what realistically were Gloria's options? Now, a pro-life center would have taken a holistic approach to her predicament. She was struggling financially, and with her health problems, she was probably also struggling to manage a household with so many children, even though the oldest were old enough to help take care of the youngest. The fact that she was raising 6 children on her own kind of indicates that she may have lacked the skills to bring reliable men into her life, and her work skills seemed to be limited to the physical labor that her health wouldn't allow. So help finding a sedentary job certainly would have helped, and maybe look into some better doctors to deal with her health problems. There are all kinds of things that could have worked with. Again, pregnancy centers take a holistic approach, but abortion doesn't require a holistic approach. It just focuses on getting rid of the fetus, and you're leaving the woman in her same unfavorable circumstances. Now, Dr. Spohr expressed awareness that Gloria was a high-risk patient, either for an abortion or for carrying to term. But news coverage doesn't indicate that he referred her to a high-risk OBGYN who might have been able to give her more specific guidance. Was Spohr so focused on the idea that the baby might have health problems that he fixated on the idea that the child had to be aborted, or was he just stuck thinking in that direction because Gloria had already scheduled an abortion? And what would a high-risk OBGYN have done? Well, by the late 1970s, he or she certainly would have had access to ultrasound to better assess the health of Gloria's unborn baby. And he or she might have had a better idea of the comparative risks of carrying to term versus aborting. If a high-risk OBGYN believed that an abortion was indeed the best option, Gloria almost certainly would have been admitted to a hospital for the procedure, and her medical assistants would have paid for it as a medical necessity. So sending her to an abortion clinic was a shortcoming on Dr. Spohr's part. Well, let's go on to the abortion. Before the abortion started, Gloria's vital signs were good. Her blood pressure at 11:45 was 122/84, and her pulse was 84. All pretty good. Tauber was assisted by registered nurse Carolyn MacArthur and OR tech Cynthia Legee. Gloria's surgery was started at 12:05 p.m., but about 45 minutes into the procedure, there was a sudden gush of blood. Tauber inserted a scope through Gloria's navel to try to identify the source of the bleeding. Legee said later that she was the one who observed through the scope as Tauber completed the abortion, and the only injury she saw was a hole about a half-inch long along the lower right side of the uterus. That nick was not enough to account for the copious amount of blood that Gloria seemed to be suffering. Now, the surgery was completed at 1:25 p.m., nearly an hour and a half after it was started, and by then Gloria's blood pressure had fallen to 80/60 and her pulse had risen to 96. This was a sign of severe internal bleeding. Tauber packed Gloria's uterus with medical gauze, which appeared to control the bleeding, but by this point, Gloria had lost an estimated 1,500 cc's, or 3 units of blood. Tauber documented his patient's condition as borderline. He administered IV fluids, continued cardiac monitoring, and ensured that she was being attended by a nurse. Got to give him credit for that. Tauber handwrote on her chart, plan, observe, and transfuse. If deteriorates, transfer for hysterectomy. And he ordered blood from the Central Florida Blood Bank at 4:30 p.m. Now, while he was waiting for the blood to arrive, he called Orlando Regional Medical Center, and the resident on call instructed him to call the attending obstetric physician. So around 5:30 or 6, Tauber called Dr. A.J. Herron to get clearance to admit her to Orlando Regional. Herron approved the transfer, but Tauber decided to try to stabilize his patient at the birthing center. And also at around 6 p.m., Gloria's friend Leroy Feaster came by with the two youngest children, expecting to take her home. By then, the first blood had already arrived, and Gloria was in the process of getting a transfusion. So he was told that she would have to be kept overnight. And Leroy went back to speak to her. She reassured him that there'd just been a problem with her blood pressure and that it was being addressed. And she smiled as Leroy gave her a goodbye kiss on the cheek. Tauber administered a second transfusion, concluded that Gloria was recovering, and left his patient in the care of a crisis nurse and Nurse MacArthur. Now, Tauber came back around 9:30 on the morning of March 7th. Gloria's vital signs had remained stable during the night, and Gloria was sitting up on the side of the bed and had gotten up and showered, but she still reported abdominal pain. Now, Tauber attributed this to the laparoscopic surgery and just kept her for observation. Nurse Legree said that all signs of internal bleeding had stopped. Gloria's abdomen was soft. It wasn't tender. She spent the afternoon watching TV and chatting with the nurses. She showed off pictures of her children and told Legree that her oldest son had just gotten back from Job Corps and was going to be a help to the family. And again, if she had gone to a pro-life center, there's a good likelihood they would have gotten a really good job for this boy. Now, around 5:30, Leroy Feaster came by again expecting to take Gloria home. He looked into her room and decided not to disturb her because she was sleeping. He never saw her alive again. Around 6 p.m., Gloria walked to the operating room to have the packing removed. Tauber was pulling out slowly, but about 3/4 of the way through the process, there was a sudden, massive gush of blood, and Gloria's blood pressure plummeted. Tauber ordered meds to contract her uterus and told his staff to call 911 and to cancel the order for the blood to be delivered from the blood bank so it would be available for her at the hospital. So again, he shouldn't have dragged his feet about transferring her to the hospital, but at least he is taking some steps to try to arrange for her to get proper care. Now, while waiting for the ambulance, Tauber packed Gloria's uterus and vagina with more gauze. And Nurse B.J. Carruth lowered Gloria's head so it was lower than her feet to direct more blood and oxygen to her brain. Nurse Carruth later said, Mrs. Small was looking around quietly, but obviously frightened, obviously in pain. She was instinctively trying to roll over. We reminded her to lie still, and she said, okay, okay, okay. Now, the staff who contacted ambulance dispatch gave kind of contradictory instructions. She later said that she said there was an emergency and used the words stat and emergency, but she also said to come without making a commotion about it. Oh, that's supposed to be hemorrhage. Okay, so this led to the ambulance being dispatched as a routine transfer, no lights, no siren. So it was half an hour later when the lights and siren blaring, the ambulance headed from the birthing center to the hospital. Gloria arrived accompanied by Tauber at 6:52 p.m. EMS said that she was awake and talking, alert, but lethargic and weak. Now, what happened at the hospital is kind of unclear. Dr. Herron said that he had been notified that Gloria was being transferred and began his drive to the hospital. And while he was on the way, he got a notice on his pager that she'd arrived at the ER and gone into cardiac arrest. And different hospital staff give different accounts of whether the internal bleeding was diagnosed promptly. Gloria's blood pressure was 82/56 at 7 p.m. It looks like there was pretty clearly internal bleeding. Now, Tauber was not part of the hospital staff, so he was no longer able to provide care. He reported that he kept telling the hospital staff that he'd ordered 2 units of blood that were at the blood bank across the street, but hospital policy said they couldn't use blood that had been ordered based on type matching done at another facility. Things were chaotic. Gloria's condition was deteriorating rapidly. She went into cardiorespiratory rest and was provided with resuscitation efforts. They got her pulse restored by the time she got her first transfusion at 7:40 p.m., but she was also still being bagged to keep the air going in and out of her lungs as she was brought into the operating room at 7:47 p.m. Now, Heron arrived at the hospital and was briefed by staff as he prepared to operate, and another doctor, R.O. Van Dyke, arrived to assist. So the surgery began at 7:55 p.m. Gloria's uterus was distended from all the gauze packing, which was poking out through a 1.5-inch tear. A resident photographed the damaged uterus as Heron surgically removed it. During the surgery that lasted more than an hour, Gloria received 5 units of blood, but Dr. Heron estimated that this only made up for about a quarter of the blood his patient had lost. By the time the surgery was over and Gloria was transferred to the intensive care unit at 9:50 p.m., she was barely clinging to life, and 5 minutes later she was dead. Now, it was sometime after midnight before anybody called Gloria's 19-year-old son, Terry, and told him to come to the hospital as soon as possible. So Terry called Leroy Feaster, telling him that the hospital had called. So Feaster had to get off work early, and then, confused, he went to the birthing center rather than to the hospital. The receptionist directed him to the hospital. The hospital sent him to the medical examiner's office. Leroy said that the assistant medical examiner, Judith Bunker, hemmed and hawed and finally came around to telling him that Gloria had died. And as Leroy broke down, he later recalled, Bunker told him that Tauber had kept Gloria at the center too long and should have brought her to the hospital for surgery right away. Fix a typo. Now, Leroy contacted Gloria's sister in De Leon Springs so that they could arrange for the funeral. Now, on March 10th, the medical examiner's office and police department met to discuss the case, but somebody at the state attorney's office leaked the story to WDBO Channel 6 News. This led to concerns that Tauber would have a chance to destroy records and cover his tracks. A Channel 6 reporter said that he sat in a van across the street from the birthing center with a 6-pack of beer for 4 hours waiting for the raid. When a raid came at 11:25 that night, the media rushed up to the search party as they entered the birthing center where 3 women were in labor. It was a circus. The medical examiner said that Gloria's medical history should have precluded performing an abortion in an outpatient setting, and the medical board faulted him with failing to transfer her to a hospital as soon as he'd had the bleeding stabilized with packing, rather than trying to remove the packing in a setting where there was not immediate blood available for transfusion. And a court-appointed panel found Tauber negligent in Gloria's death. Now, the repercussions for the 31-year-old Tauber were astonishing given the legality of Gloria's abortion. He was dismissed entirely from the staff of 2 hospitals, had his medical license suspended, and was charged with manslaughter. Now, I found no record that the case ever went to trial, and Tauber relocated to Detroit, where he finally got around to completing a residency in obstetrics and gynecology. This after running a birthing center. And he went to work at the Scottsdale Medical Clinic abortion facility. And I haven't been able to track him after that. And just to add a note, Gloria, like other black women, faced a higher risk of abortion death than a white woman. Really wish Gloria had gone to a pro-life center who would have found a team of doctors to address her problems and would have helped her with her financial problems so she wouldn't feel like the only choice she had was to kill her 7th child.